When someone shares an experience of weight stigma with us, it's crucial that we acknowledge that weight stigma exists and that this is a reality for many people living with higher weight. When experiences of weight stigma are shared with us, it's important to recognise this and thank the person for being open with us about these difficult experiences. We should try and highlight that we understand that such instances do occur in society and that we believe that this has taken place for them. We should acknowledge with them that stigma can have a negative impact on their daily lives. For example, their ability to access healthcare or their motivation to work on their weight. That can affect their motivation no matter how important working on their weight is to them. We should try to use this experience to understand from the individual who we're trying to support what has been unhelpful for them in the past and what we and others can do differently moving forward to better meet their needs and empower them to work on their goals. It's important to remember that some people may have only experienced negative, critical views and opinions, tough love for the want of a better phrase, in the past around their weight. Evidence suggests that critical and negative views tend not to have a motivating benefit for people trying to work on their weight. Evidence now suggests that approaching weight management from a compassionate, understanding point of view enhances individuals' chances of longer term weight management, helping them to ride through the many challenges, setbacks, and blips that can happen on a normal weight management journey. People with higher weight do not just share their experiences of weight stigma with psychologists like me, they may disclose such events with anyone. If someone does tell you about their experience of stigma and you're not feeling confident about how to respond, perhaps not feeling you have the right level of training or skills to support the individual, remember that listening respectfully and compassionately can sometimes be enough. Letting that person know that they are being heard, trying our best to validate their experience, and again, reminding them that we believe them. If you are, however, concerned about the person's emotional well-being and think they might need access to more support beyond what you can offer them, depending on the context of where you're having contact with the individual, there may be different routes of support you can consider seeking advice from or directing them to. If you have a psychologist or mental health professional like me in your organisation, approach them for advice. If not, it could be a senior staff member, a colleague you trust, supervisor or line manager. It could even be from the person's GP. Remember, however, that it's important to check with the person you're working with first if they're looking for and motivated for support. We would always want to have the individual's consent to discuss what they've reported with us as well. So again, make sure to check this out with them first. Some people's experiences of weight stigma may have been part of a wider traumatic event or series of events in their lives. If you're looking to better understand the impact of trauma and adversity alongside this training platform and weight stigma, there are excellent training packages available within Scotland supporting how we can develop trauma-informed skills across various settings, such as in education, health and social care. We all have a role in trying to better support and meet the needs of people who've experienced adversity and trauma in their lives. Links to useful resources on trauma-informed practices and training packages have been included in this module.